statement by that party. And we're sharing this particular. Next slide. So these are some of the rundown of what we teach. We hospital personnel on disaster risk reduction. These new concepts are now being. When I went to medical school, unfortunately, nobody taught me about it. I had to learn it from my own experience and my own work after that. So all the current writings. So initially they were size models. The current version of HOPE is now a multi-hazard HOPE. And when we the main disaster that affects Asia is actually flooding. So we've now put four basic hazards for risk in Asia in the HOPE course. One is actually floods. Two is basically the cyclones and the typhoons. Third is and the last is hospital fire, when your hospital has an internal disaster. So these are the four main efforts or examples of incidents that you can focus on to make your hospitals safer in the future. So this is the objective. I don't have detail because the idea is to just introduce the fact that the idea is risk management, risk reduction principles. Together everyone achieves more. Team effort. Because everyone must do their role to make the hospitals continue. So even the parliamentarians, and if you are parliamentarians or senators or people in your government, if your hospital fails, it is not the doctor that's blamed. They will say the government doesn't. So basically it is a mirror of what the people will need right after disaster. So if you're unable to provide services to the population that is affected by risks, you will be blamed. I mean, the doctors will blame our government officials for not supporting. So there are performance objectives, and we vulnerability assessment of the hospital. And as this campaign actually goes on, what we're trying to tell administrators, the government, is you can assess risk. Where are your hospitals located? What are the risks that the hospital is exposed to? This risk can be reduced with proper planning and a way to assess what is the vulnerability of that hospital. A way to improve and review your hospital plans. Most of the time, hospital written plans that are put in the cabinet, the director of the hospital, and nobody reads it. If you go to the hospital, we're going to do when there is a flood in this hospital or when a cyclone comes. Most nurse or the doctor wouldn't know, because what they do every day, the idea is to disseminate this preparedness, review it to the staff, and what we do is to be able to make drills or conduct an actual response, an emergency. So they can simulate it, they can time it, they will know how they will during an actual disaster risk. Next. So this is the home course is only part of a bigger program, and the program is called PEER. PEER stands for Program for Enhancement of Emergency. And this was developed in Latin America, and this was developed by the Office of Foreign Disaster Assistance and USA, and they were geared towards pre-hospital. What happens in community? So the initial courses that were developed by the PEER course, First Responder course, or the MFR, which is to train policemen and rescue people on how to treat people who are affected in the site. There is the collapse structure search and rescue, and HOPE is the Asian. When they were giving this to us in Asia, we said, well, even if you bring them to the hospital, if the hospital isn't functioning, your patients that you rescued are still going to die. So we said we develop some kind of capacity building course for the people working in the hospital. And the rest are other subsidiary courses. And as a regional program, we do not tell the country how they will do it. Like what she did, she took the whole course, adapted it, and fixed it so that it's better in the Philippines. Because in the regional level, we have to look at the regions, the different countries, the commonalities, and then let each country run and modify it that will best fit their political system, their government, and their resources. So the idea is just to train a lot of instructors and propagate this in the different countries. Next slide. So this is like the framework. There is a disaster there over on the right, and people have to do rescue when they have to be extricated, and in the scene they have to be given some form of medical assistance. So people will be trained to assist them, and they will be brought to the hospital. If this segment does not occur, what actually happens is this transfers from the scene to the hospital, and this will collapse. It will what we call a functional collapse, because the hospital will be able to take in huge numbers of victims coming into their doors at one given time. Next slide. So this is the people that funded this agency. Initially, it was run by the Asian Disaster Preparedness Center, based in Bangkok. Later on, it was transferred to. We are still running this program. In fact, November 11 to 15, we will be running another course in Kathmandu. Next slide. And it's a regional course. So the process was like this. We made agreements with national authorities, people who were in charge of their national disaster program. Like one lady here who is in charge of the national disaster. We would coordinate with those people in those specific target countries. We signed a memorandum of agreement, and then support was given in terms of financial support to run. And they choose who were the instructors who lead. Baby's team was chosen. A lot of them were put in, and they were eventually modified this to the HEART program. Okay. So we started delivering the regional and sub-regional and some national courses. After the national courses, each of the countries left to do what they want to do with a particular course. Next slide. The next slide, please. Okay, so let me run you through in the different countries where HOPE is being implemented. In Bangladesh, this was given to the Ministry of Health and the National Institute for Preventive and Social Medicine. And they've run several courses. I think in 2007, 2008, this year, they also run a course. So they've been using this, and they've implemented recently, which is now more flood preparedness. Next slide. Indonesia is a very good example because we started HOPE courses in Indonesia way before the tsunami. And when the tsunami hit, not you know, that the first functioning hospital that was run by the Indonesian military, who were all trained course. Basically because one of the proponents of the HOPE, the Professor Pospodegoro of Indonesia, he's my colleague. Also got a vast experience in earthquakes and disasters in Indonesia. And they were able to operate on the first 48 hours because this is the principle of disaster risk. Yo-yo principle, we call it, which is basically you're on your for the first 24 to 48 hours. None of these international agencies first world countries will be able to come to your aid in about 48 to 72 hours.